Needle phobia is a very common phobia, and we know that it affects males in equal proportions to females, and it's looking at around 25% of the population. So this causes us some concern with regards to the vaccination uptake, because the primary behaviour associated with needle phobia is an explicit avoidance of medical procedures, mainly needle-related procedures. Someone with a needle phobia may take longer to vaccinate than someone else because they spend a long time having to psych themselves up towards getting the procedure, and they also tend to rely on a suite of unhelpful behaviours, including bringing extra people along to the appointment, having various superstitions, having to take numerous attempts to actually walk in that room, let alone actually sit down and get the needle. In some cases, people do prefer certain practitioners, so they may ask for nurses to swap in or out. We don't like the idea of people having to be held down and requiring extra assistance in that way. Most usually, people just bring extra people to the appointment, so a lot of family members, partners, etc. Needle phobic clients like to have certain tools upon them to help them get through procedures, and where this can be quick, independent strategies, this is going to be the best for both sides of the coin. So a technology like NeedleCalm is really important because it is something that the client can bring along themselves, they can administer very, very quickly, and it can just be a smoother and more effective process for everyone. Obviously, we don't want any barriers with the COVID vaccination, so anything that gets clients in the doors happy and willing to get the vaccination is good news for everyone. NeedleCalm actually is, one part of that, but also anything else that can be done to improve the willingness and to ensure the comfort and control for the individual getting the procedure is a good thing. We see that needle phobia is a barrier for a range of medical procedures and family planning and other really big decisions as well. So in that regard, we do expect that needle phobia will create quite the barrier for the COVID vaccination uptake.
And do you believe?
NeedleCalm would be a really valuable product for someone with a needle phobia to increase their confidence going in to get the COVID vaccination.
Cool. And
people with a needle phobia tend to avoid any presentation of needles or discussions of needles, vaccinations, anything like that. My top tip would be to try to expose yourself early to any of the information around needles, because this puts you in a better position before you have to go get a needle yourself. Equally, practicing any strategies that you're wanting to rely on, controlled breathing, the NeedleCalm product, anything else like this should be done beforehand rather than when you really want to rely on it in a pathologist's chair.
So NeedleCalm was invented by myself 2016. I was unwell, I had a few surgeries on my ear, and I also had a needle stick injury. So following those two events, I thought about the procedure and how we could do things a bit better and invented NeedleCalm. So it's a Class 1 medical device. It's used to desensitise the skin from the pain of the injection. It goes on the skin prior to having the injection and then is removed afterwards. So the patients I was looking after in emergency often had poor health outcomes and weren't in the best shape they could be. So I asked them why, and most often than not they had a fear of needles and they hadn't been to the GP clinic. So their fear of needles developed when they were early on and they had a poor experience. So NeedleCalm is about preventing that whole scenario from happening. So there's a lot of people obviously wanting to have the vaccination but are scared too. So we've pushed hard to get NeedleCalm out onto the market and to have it available ready for the public.